So it gives me great pleasure in introducing Dr. Julia Chan, who's from the Chinese University of Hong Kong. She's an assistant professor out there with extensive knowledge on the epidemiology. And she's going to talk to us about solar damage. Being in the Asia Pacific region, solar exposures are much more. And we do see a lot of solar surface damages like pterygium, which is more common, nuclear sclerosis. And sometimes we get a lot of patients in whom we don't exactly have a diagnosis, but one of the risk factors are solar exposure. Dr. Chan.
Thank you so much for the kind introduction. Solar damage is a very serious problem, particularly in Hong Kong. In the following, I'm going to illustrate a case series of photokeratitis outbreak in Hong Kong 2 years ago. I have no relevant financial disclosure. So I would like to acknowledge my chairman seniors and my support from Hong Kong in making this presentation possible. So photokeratitis is a type of acute inflammation of the cornea related to ultraviolet radiation light exposure. Depending on the UVA, UVB, or UVC, this will cause epithelial haze, stromal haze, corneal edema, or even penetrate inwards towards affecting the lens. So as I have mentioned earlier, a quick recap on physics. We know that electromagnetic wave manifest according to different wavelengths. And beyond visible lights, we can see a lot of UVA, UVB, and UVC. And this will depend, and if penetrate into our eye, will cause a lot of severe problems. This illustrates that UVC will primarily affects the epithelium of the eyes, while UVB might penetrate into the anterior chamber, and UVA, with the longest wavelength among the three, will cause damage to the lens. And the maximal spectral responsivity will be affecting at around 288 nanometers. So how do we get ultraviolet C radiation in the environment? Because all the ultraviolet C radiation from the cosmos, from the universe, has already been absorbed by the atmosphere. So all the UVCs affecting humans' eyes are those that are man-made, which can be classified into recreational, disinfecting devices, and others. So a look back at the masked photokeratitis in literature, we can find that there are multiple causes that are at risk. For example, in nightclubs with improper installments of UVC lights as purple lights. In hospital coronary angiography units, where the disinfecting facilities incorrectly emits UVC lights. In gymnasiums, in restaurants, even in livestock auction house. And the commercially available COVID-19 pandemic lights are also causing photokeratitis in patients. So this was in literature where the disinfection slide door of the apron disinfecting systems does not close appropriately. It was intended that when the doors are closed, the lights will turn off, but instead it doesn't. So that's why it causes a mass photokeratitis in a Korean cohort. So how does photokeratitis manifest? It does not only affect the patient's ocular surface, but also affects the skin as well, mimicking those of a sunburn. This is a patient present to me a few months ago with wielding by himself without any protections at all, complaining of severe tearing, eye pain, and also an obvious skin burn. And this is his presentation to me 1 day after the condition. So let me carry on the photokeratitis mass outbreak in Hong Kong 2 years ago. In 2023, in November, there was a spike of 8 patients suddenly seek medical attention, all complaining of eye symptoms. All of them have a common exposure of an outdoor event from 5 p.m. to 11 p.m. on the day of November the 4th, 2023, where there was an event held at the Kai Tak Cruise Terminal, where the airport was previously situated in Hong Kong. So the patient's demographics are listed below. You can find that the mixed ethnicity in this cohort, because it was an international event back then. And you can see that the age of the affected patients are relatively young. And as you can see, for the duration of exposure, there is the duration of exposure is around 3 hours, and the presentations was far delayed until 8 hours after the event. And you can see that only 3 patients were wearing contact lenses at that time. And none of them are wearing any protective tinted spectacles because it's an event at night. The clinical presentations of this cohort complained of very common eye irritation symptoms ranging from eye pain, red eye, photophobia, tearing, and there's no specific laterality difference in terms of visual acuity on presentation. These are the other clinical literature, how photokeratitis was documented in literature. And as you can see that all the patients will present in similar ways as it is. So majority of the patients presented to the emergency department because it was late at night, and often being assessed by emergency department colleagues only. At that time, a majority of them suffers from corneal and conjunctival involvement, but none of them has manifestation over the anterior chamber. Depending on who they attended, some of the A&E doctors even prescribe patients with antihistamine, thinking that it's an acute case of allergic conjunctivitis. So I would like to illustrate further with a case of photokeratitis in one of the 8 patients who presented to me later. It is a 40-year-old female who complained of both eyes redness and pain for 4 hours. She has been on regular contact lens use and using daily contact lens for 12 hours wear each day. When she attended the event at the Kaita Cruise Terminal, she was exposed to an indoor display room, documented over here, where there's a dimension of a quite small room, 4 times 6 meters square, and staying there for 20 minutes for some photo taking and uploading it into the Instagram or other social media. And these are the actual pictures taken by the patient herself. As you can see, that is very apparent that those displays all demonstrate fluoresceins. And then, after the event of taking pictures in an enclosed function, they proceed forward to an outdoor event concert where they were 3 meters away from the stage and stayed there for 3 hours. So at the midnight, she attended the emergency department for severe tenderness. Her vision was maintained well, but then there's ciliary vasodilation and staining was negative for them. And the A&E department prescribed her with painkillers and also some antibiotics. She attended tertiary eye surface on day 3 for follow-up. By that time she attended, the conjunctiva is already white, and there is absent of any other corneal manifestation as well as lens manifestation, and she was prescribed with lubricants. And this is the particular patient I have been mentioned, and you can see that by the time she attended me on day 10, all the symptoms have been resolved, and also the tear breakup time of the eyes are maintained, and also specular microscopy performed on that day showed no changes in normal cell density in these kinds of patients. And the same is on the fellow eye. So this mass photokeratitis was brought into the attention of mass media, and this was published and covered in majority of newspapers. So to conclude, this was indeed, looking back into literature, was not the only time when there was a mass photokeratitis outbreak in Hong Kong. Looking back a few years ago, in 2008, there was another outbreak where the organizer of the exhibits did something wrong by introducing the UVC lights and still it again for a public function. So, thank you for your kind attention, and this is a presentation of me illustrating the first documented in literature to document symptoms, signs, and clinical course of mass photokeratitis for recreational purpose. There is a dire need for regulation on UV emitting device and to prevent further situations from happening again. So before I conclude my presentation, I would like to all invite you not only to the APAO 2026 in Hong Kong, but also save the date for our ACS, which will be held in the same year, but in December 2026. Thank you so much.